Targeted therapy for cancer, a comprehensive overview. Introduction. Targeted therapy is a form of cancer treatment that uses drugs or other substances to precisely identify and attack cancer cells while minimizing damage to normal cells. Unlike traditional chemotherapy, which affects rapidly dividing cells indiscriminately, targeted therapy interferes with specific molecules involved in the growth, progression, and spread of cancer. These molecules are often referred to as the molecular targets. How targeted therapy works. Targeted therapies are designed to act on specific abnormalities within cancer cells. These abnormalities may include 1. Genetic mutations, changes in DNA that promote cancer growth. 2. Proteins, overexpression or altered activity of proteins driving tumor survival. 3. Cell signaling pathways, aberrant signaling networks that encourage cancer cell proliferation and survival. Key mechanisms include blocking cancer growth signals, drugs that inhibit growth factor receptors, e.g., EGFR inhibitors, inducing cancer cell death, promoting apoptosis in cancer cells, preventing angiogenesis, stopping the formation of new blood vessels that feed tumors, modulating the immune system, enhancing the immune system's ability to detect and destroy cancer cells. Types of targeted therapy. 1. Monoclonal antibodies, lab-made proteins designed to bind to specific antigens on cancer cells. Examples: trastuzumab, Herceptin, targets HER2-positive breast cancer. Bevacizumab, Avastin, inhibits vascular endothelial growth factor, VEF. 2. Small molecule inhibitors. These are drugs that enter cells and interfere with specific proteins or enzymes. Examples: imatinib, Gleevec, targets BCR-ABL in chronic myeloid leukemia, CML. Erlotinib, Tarceva, inhibits EGFR in non-small cell lung cancer. 3. Hormone therapies. Block hormones that fuel certain cancers. Examples: tamoxifen for estrogen receptor-positive breast cancer. Abiraterone for advanced prostate cancer. 4. Angiogenesis inhibitors target blood vessel growth that supplies tumors. Examples: ramucirumab blocks VEGFR2/5. Immunotherapy, checkpoint inhibitors. Although distinct from traditional targeted therapies, some overlap exists. Examples: pembrolizumab, Keytruda, targets PD-1 to enhance immune response. Advantages of targeted therapy. Precision, reduces harm to normal cells. Fewer side effects, generally better tolerated than chemotherapy. Personalization, allows for treatments tailored to the individual's cancer profile. Synergy, can be combined with other treatments like chemotherapy, radiation, or immunotherapy for enhanced efficacy. Challenges and limitations. 1. Resistance. Cancer cells may develop resistance to targeted therapies over time. Combination therapies are often explored to counter this. 2. Not universally applicable. Targeted therapies are effective only if the cancer expresses the specific target. 3. Side effects. While milder than chemotherapy, some targeted therapies cause fatigue, skin issues, or diarrhea. Immune-related side effects can occur with some immunotherapies. 4. High costs. Targeted therapies are often expensive and may not be universally accessible. Biomarker testing. Targeted therapies require biomarker testing to identify specific molecular targets. Techniques include next-generation sequencing, NGS, comprehensive genetic profiling. Immunohistochemistry, IHC, detects specific proteins. Fluorescence in situ hybridization, FISH, identifies genetic abnormalities. Examples of targeted therapy in cancer treatment. Type of cancer: BRAF V600E mutation, breast cancer, trastuzumab Herceptin, HER2, lung cancer, Tagrisso, EGFR, melanoma, vemurafenib, Zelboraf, BRAF V600E mutation, chronic myeloid leukemia, BCR-ABL, colorectal cancer, CEP, colorectal cancer, cetuximab, Erbitux, EGFR. 1. Combination therapies, using targeted therapy alongside other modalities like immunotherapy. 2. Liquid biopsies, non-invasive tests to monitor mutations and resistance. 3. Gene editing, CRISPR technology to directly correct cancer-driving mutations. 4. Expanding targets, developing drugs for less common genetic alterations. Conclusion: targeted therapy represents a revolutionary approach in cancer treatment, offering hope for more precise, effective, and less toxic treatments. While challenges like resistance and cost remain, ongoing research promises to expand its scope and accessibility.